The bacterial infection known as tuberculosis has been killing people for thousands of years. The contagious disease has been traced as far back as the age of Egyptian mummies. Today, the public health arm of the United Nations keeps close tabs on TB. Dr. Jacob Kumaresan is executive director of the World Health Organization's New York office. He says the disease continues to take its toll.
Tuberculosis still accounts for several million cases per year, approximately 9 million cases per year. And of this, many of them die, and most of them are in the developing world in Asia and Africa. So it is still a significant problem worldwide.
TB can be cured, but the treatment involves a number of antibiotics that must be taken for at least 6 months. People often start feeling better in a few weeks and then stop taking their medication. That's when multi-drug resistant TB can develop.
And this is a very serious problem. So you have to make sure that you account for every patient, manage them properly, and ensure that after 6 months they've been treated and they are completely free of the disease.
That kind of case management is a challenge in Tijuana, where poverty is widespread and public health resources are limited. Tuberculosis is a problem throughout Mexico, but for some reason, there are more cases of TB here in Tijuana than in any other part of the country. The Centro de Salud downtown is where most TB patients go for care. The TB clinic is housed in a separate building on the property with its own ventilation system. The clinic's Dr. Concepcion Corona Rubio has been treating TB patients for 18 years.
There are a number of factors that predispose our population to tuberculosis. Here in the community, there are a lot of immigrants, a lot of people who abuse drugs, and this is driving up the number of people who test positive.
Dr. Corona says some of the immigrants come to Tijuana already infected and then move into poor housing.
Cramped places, poorly ventilated, crowded immigrant shelters. These kind of places facilitate transmission of the disease.
For the last 8 years, San Diego-based Project Concern International has given Tijuana's fight against TB a major boost. Director Blanca Lomelí says their program, Solución TB, has helped change the way public health officials look at the disease.
So instead of focusing on, X amount of people affected, like, just looking at the statistics, the rate is 46% per 100,000 people. Instead of looking at that, you look at the individuals and try to identify why people are getting infected, why people are getting the disease, why they're abandoning treatment, etc. And then you design the program around that.
Solución TB has helped fund the hiring of public health workers who go to patients' homes and make sure they're taking their medicine. The program has also encouraged health officials to increase TB testing and get people diagnosed earlier in the disease process.
And we also work with the communities, on the other hand, with the public, for the individuals with the disease to be more empowered, more participant, more active, more responsible for their results. And that combination is what has helped change the way things are done.
Dr. Paris Cerecer Cayu heads up tuberculosis services in Tijuana. He says Solución TB has helped the health ministry integrate its TB program with efforts to control HIV and diabetes. People with these diseases are at higher risk of getting TB.
This project has also helped us find people at high risk who we hadn't identified yet. What's more, they provided training for the medical community and public health workers who deal with TB patients.
But funding for Solución TB, which comes from the U.S. Agency for International Development, ends in December. Despite efforts to control the disease, Tijuana still averages about 800 new TB cases a year. Program Director Blanca Lomelí hopes public health officials in Tijuana will keep up the fight. But she's concerned that the new Mexican president and health secretary may have different priorities.
What we have learned with TB is that when you stop investing resources in the disease, things go, back up in terms of they go worse. So that's what we hope doesn't happen.